Hey everyone, we are just weeks away from the Platinum Ambassador Assembly here in Washington, D.C. This video will focus on the legislative asks for the second day of the Assembly as you go around on Capitol Hill. So as we go through the video, it might be helpful to print off the legislative asks packet that's available online as we go through the presentations. You can take any notes and follow along. The Platinum Ambassador Assembly really is a first of its kind event that we're excited to host in just a few weeks to help you cultivate the skills to take your precision advocacy to the next level on Capitol Hill and in your local communities. So many of the key issues in healthcare that we'll be taking to Capitol Hill will allow you the ability to share your story with your member of Congress and advocate for policy issues that you're most passionate about. So that was the idea behind our kind of ask structure here. As you can see that we've got two core legislative asks, both of which I think you'll be very familiar, followed by this menu of policy issues to really allow you the chance to take control of your advocacy and speak to an issue that you're most passionate about. First, let's start with the core legislative asks that revolve around step therapy and the Congressional Arthritis Caucus. Let's start with the core ask of step therapy reform. Many of you may already be familiar with the H.R. 2077, the Restoring the Patient's Voice Act that was introduced last year in Congress. So the bill really focuses on three key things that deal with step therapy. The first is calling for a clear and transparent process to seek exceptions to step therapy review by health insurance plans, establishing a reasonable and clear timeframe for decisions to override the insurer, and requiring insurers to consider the patient's medical history, the provider's expertise in partnership with their own patient, and respect the healthcare provider's professional judgment, all before a health plan can delay or outright deny a patient's ability to access a medically necessary treatment. So those are the three key things the bill does. With respect to the lead sponsors of the bill in the House, we have two physicians, Representative Brad Wenstrup, a Republican from Ohio, and Representative Raul Ruiz, a Democrat from California. They're joined on the bill by nearly 40 bipartisan co-sponsors, which is a testament to your grassroots advocacy. And there's currently no companion bill in the U.S. Senate. So for those of you that may have a meeting with your senator, a key part of the ask will be requesting that they sponsor a companion bill to H.R. 2077. Next, turning to our second core legislative ask revolving around the Bipartisan Arthritis Caucus. As you know, greater education and awareness is really critical to breaking down barriers for people with arthritis. So the legislative ask on the Arthritis Caucus has been one that we've used in years past and will continue to do so because the coalition is now 140 plus strong with members from both the House and the Senate. So going forward, the continued focus is building a strong caucus that can highlight the scope of arthritis and other rheumatic diseases, the shortage of rheumatologists and pediatric rheumatologists, and the importance of biomedical research that can really help unlock treatments and cures. So one of the caucus co-chairs is Representative Anna Eshoo, a Democrat from California, and the other is Representative David McKinley, a Republican from West Virginia. So Anna Eshoo has said in the past that, quote, arthritis is not a Republican or a Democratic disease. Chronic diseases bear none of those labels, and it really behooves us to work together. All right, turning next to our new menu of legislative asks that are one of a kind this year and what we really wanted to try out with our Platinum Ambassadors this year on Capitol Hill. So we put together a list of a half dozen legislative asks this year, some of which you may already be familiar. And the idea here is that you can choose one of these items in addition to our core legislative asks to speak about in your meetings and really share your story. So we'll walk through each of these in turn in the following slides. The first policy issue to select off the menu is ensuring access to pediatric rheumatologists. So as you may already be familiar, H.R. 3767 or S989 in the Senate is the Ensuring Children's Access to Specialty Care Act. So the bill really focuses on addressing pediatric subspecialist shortages by allowing providers like pediatric rheumatologists to be eligible for loan repayment in exchange for practicing in rural and underserved areas. So this kind of loan repayment program actually can really incentivize physicians to practice in these areas and really fill in the gaps where care is needed. So the bill, as I mentioned, does have sponsorship on both the House and the Senate side, which is terrific. And on the House side, the bill is sponsored by Representatives Billy Long from Missouri and Joe Courtney from Connecticut. On the Senate side, the bill is sponsored by Roy Blunt from Missouri and Senator Jack Reed from Rhode Island. The bill is supported by more than 40 national organizations, including the Arthritis Foundation, the American Academy of Pediatrics, and the American Academy of Child and Adolescent Psychiatry, among many others. Next on the menu list is the PATA bill, or Patients' Access to Treatments Act, H.R. 2999. You may already be very familiar with this bill because it's been circulating in Congress for the last couple of years. But the bill would really require commercial health insurance companies to cap the copayment for specialty drugs at the level for the non-preferred brand drug tier. So one of the lead sponsors of the bill is Representative David McKinley from West Virginia. As you know, he's also the co-chair of the Arthritis Caucus, and he's joined by Representative Lois Capps of California. The bill currently has 30 bipartisan co-sponsors, and we're really looking to move those numbers higher as we go throughout this year. Moving on to the next menu item that's focused on research for a cure, specifically at the Department of Defense. So as you may know, service members often carry heavy packs that can injure and weaken their joints. And shockwaves from bomb blasts, for example, can cause early joint damage leading to post-traumatic osteoarthritis, which is the second most common reason soldiers are medically discharged from the Army. So further arthritis research can really help identify not only better joint injury management to reduce the effect of joint degeneration, but identify ways to lessen joint injury during military training, which will lead to more effective treatments for all people with arthritis. So what can Congress do with respect to research for a cure at the Department of Defense? Well, if you've been to prior summits we've held in Washington, D.C., the ask is very much the same. It's asking your member of Congress to submit a letter of request to the Appropriations Subcommittee on Defense asking for a standalone arthritis program at the Department of Defense, funded at $20 million. Because right now, arthritis and clinical care research on military personnel is limited, and the funding stream year to year is in flux. So a dedicated program will provide certainty for the research community in conducting this important science. Turning to the fourth menu item of our list of 6 legislative asks is funding arthritis public health programs. So as you may know, the Centers for Disease Control and Prevention is the only federal program dedicated solely to arthritis research and data collection that is vital to understanding arthritis prevalence, factors impacting quality of life, and other trends for individuals with this chronic disease. So the arthritis program actually also funds states and national partners to deliver evidence-based exercise and self-management programs which have been proven to decrease symptoms associated with arthritis. So the goals of the program are really aligned to improve quality of life for people with arthritis and other rheumatic conditions by working with states and partners to not only increase awareness, but also decrease the overall burden of disease. Similar to the Department of Defense research ask, which we covered just a moment ago, Congress, in this case, can provide for a $5 million increase in funding in fiscal year 2019 for the CDC's arthritis program. This would bring total funding for the program to $16 million. And while this is certainly a modest increase, given the overwhelming burden of disease across the country, it would actually allow the program to operate in 2 additional states and conduct significantly more research and spread these evidence-based programs that we know are proven to work. Turning to the 5th legislative ask, we're focusing this year on enhancing flexibility of health savings accounts. So thinking about your own health insurance experience, if you have a high deductible health plan that is paired with a health savings account that you draw down to help pay for your medical expenses, this may be an appropriate legislative ask for you. So as the years have gone on over the last decade, health savings accounts that are paired with these HDHP plans are becoming much more common across the country. And we're finding that many people with arthritis are now in these types of plans that really are inflexible to patient needs. So expanding the use of health savings accounts, therefore, in a way that would be beneficial to patients would help manage out-of-pocket costs, particularly for patients that rely on expensive medications or reach their out-of-pocket maximum early in a plan year. So, in sum, there's really 5 components to our legislative ask under enhancing flexibility of HSAs. And just to recap, a health savings account is a type of savings account that lets you set aside money pre-tax, often paired with a high deductible health plan, and allows you to pay for things like deductibles, co-payments, co-insurance, and other expenses that can help lower your overall health costs. So by broadening, for example, the list of qualified medical expenses, the 5th item on this slide, is one way in order to make these plans work better. In addition, given a lot of the upfront costs that patients with rheumatic disease face if they're on an HSA high deductible health plan. Allowing the front loading of dollars ahead of time would allow them to cover much more of their medical expenses and save them the burden of high out-of-pocket costs. So last but not least is the sixth legislative ask that is focused squarely on Medicare. So for those of you that may be 65 years of age or older, or know someone who is personally on Medicare and is paying for their medications through Medicare, this may be an appropriate legislative ask for you. So this last ask is focused on capping out-of-pocket costs in Medicare. So Medicare, as you may know, is the government's health insurance program for people 65 years of age or older, or younger people with disabilities. And improving care for Medicare patients with chronic diseases like arthritis is really critical, because arthritis prevalence increases with age, and we know that about 50% of Americans over 65 have some form of arthritis. Compounded with the fact that 10,000 people are aging into Medicare every day, the spotlight has really begun to turn to policy solutions that can make Medicare work better for patients with chronic diseases, especially when it comes to out-of-pocket spending. So, in particular, there are 4 parts to Medicare. There's Medicare Part A, which is the hospital benefit, Part B, which is the outpatient or physician benefit, Part C, which is the private insurance alternative to traditional Medicare, which we think of as Medicare Parts A and B combined. And there's the 4th piece, which is really what this ask is focused on, which is Medicare Part D, which is the prescription drug benefit. So Medicare Part D has really had a tremendous effect on Medicare patients' ability to afford their medications since it was really enacted and came into effect in 2006. But unlike the health insurance exchanges on the market today, as well as many commercial plans that you might receive through an employer, there is no out-of-pocket spending cap on prescription drug coverage through Medicare Part D. So capping out-of-pocket costs in Medicare Part D is really important because a recent study found that about 60%, an overwhelming majority of patients taking specialty drugs for rheumatoid arthritis, for example, reached a phase of coverage under Medicare Part D that's called catastrophic by the month of May. So, in other words, most RA patients in the Medicare Part D program spent nearly half the plan year in this catastrophic phase. So what is this catastrophic phase? Well, it basically just means that patients, when they reach it, have reduced coinsurance rates to pay for their specialty medications. Today, that coinsurance rate is about 5%. Now, that may not sound bad, but if rheumatoid arthritis patients, for example, are reaching this phase of coverage early in the plan year, that 5% can add up really quickly. And since there's no cap on out-of-pocket costs, the costs really do escalate. So there happens to be a bill, S1347, on the Senate side only. It's sponsored by Ron Wyden, a Democrat from Oregon, and it's called the RX Cap Act, which is short for the Reducing Existing Costs Associated with Pharmaceuticals for Seniors Act. Now, members of Congress love their acronyms, so we're just going to call it the RX Cap Act, and this bill would really just eliminate that patient cost sharing above the annual out-of-pocket threshold, which is in that catastrophic phase that I mentioned, where patients pay just 5% or so of the coinsurance for their specialty medications. So Ron Wyden is joined by 4 Democratic co-sponsors on the bill, and there's currently no companion bill in the House. So if you're considering this legislative ask during the Assembly, and you're meeting with a member of Congress on the House of Representatives side, please do ask them if they'd be willing to sponsor a companion bill in the House. In addition, I wanted to mention that the President's fiscal year 2019 budget request really also includes a suggested approach for achieving this goal, either through the legislative route or on the regulatory side, and would basically phase down over a period of time what a patient pays during this phase of coverage. So as I mentioned, the threshold now for coinsurance is about 5%, and the President is proposing to phase that down to 0, although specifics beyond that are a little vague. But it's important to know that the President also has found this a priority, and that may be a nice tidbit to mention during your meetings if you choose this option. So with that, this concludes our video about our legislative asks for the Platinum Ambassador Assembly, and we look forward to seeing you in a few weeks.